today we have another topic that I want to discuss. As somebody asked me a question about this very important issue on breast, okay? I have a video on this one before. This is just a follow-up because somebody inquired about what to do, okay? So, I'm just gonna fix my camera here. A person did a comment or message me regarding bukol sa breast, okay? She is breastfeeding for more than 3 months, I believe. More than 3 months or going 4 months now. Napi-feel niya na may bukol siya sa breast, okay? Nawo-worry siya. Nagkonsulta siya sa doktor niya. And then, sabi ng doktor niya, maybe it's just milk deposits doon na naninigas, mawawala lang siguro niyan. And she is very worried. I would be worried too if that happens to me na nagbe-breastfeed ako and then suddenly may napifeel ako na bukol sa breast ko. Now, I had this video before about breast self-examination or BSE. Kailangan nyo talagang gagawin yan mga babae, mga nanay. Kahit nagbe-breastfeed kayo, if you're in your 20s now, kailangan nyo talagang i-check yung breast niyo. You can do it monthly. Dahil kailangan nyo talagang maprotektahan because again, breast screening is the best prevention, the first prevention for breast cancer. Kailangan i-check natin dahil hindi natin alam na kahit sasabihin wala sa lahi natin, at least may idea tayo na na healthy yung breast natin, wala tayong nakakapa kung anumang if there's any mass or cyst dito sa breast natin. Now, going back to this question sa moms na worry siya ngayon dahil nandiyan pa rin yung bukol sa breast niya. Ito ang na-experience ko sa mga pasyente ko sa aming breastfeeding clinic. I'm just gonna get something comfortable here para I have to sit comfortably. Okay, so here we go. So, may mga pasyente ako sa aming breastfeeding clinic na after a few months, they feel like may naninigas na mamaga sa breast nila. And then, they check it. I check it too. Sa experience ko sa aming breastfeeding clinic, may mga ibang nanay na pag nagbe-breastfeed sila and then they are maintaining the same position over and over again. Let's say you're positioning your baby always cradle like this. So when you do always cradle like this, itong side na to, dito sa part na to, ito lang talaga yung laging na-empty ni baby fully. Okay? But when you change position your baby na doing football like this, itong side na to ang nai-empty ni baby. So, my advice is kung napifeel nyo na minsan naninigas yung one side of your breast mo, may napifeel kayo na medyo milk deposit siguro na naninigas, try to massage it gently. Best to do it is use a warm cloth. Okay, warm cloth, and then put it there maybe mga 5 or 10 minutes. And then after you put that one, then you do the massage or use that warm cloth to massage. Okay, why warm cloth? Okay, so this is the difference kasi lagi kong mention sa inyo before the difference between using a warm cloth and the cold cloth. Okay, cold cloth or cold compress, you only use it if you're in pain. If there's pain, if there's discomfort, why put warm? Do not put warm. It's always cold. Now, if no pain at all, you just want to melt that milk deposits na naninigas, use a warm compress, warm cloth, warm towel. Ilalagay niyo yan dito. Massage it. Why? The reason why minsan yung ducts natin, okay, let's say this is a stick, okay? Just imagine na itong duct na to, dito dumadaloy yung milk natin, right? Dito dumadaloy. Ngayon, itong duct na to, pag nababara, dahil doon sa milk deposit na yun, alam niyo ba kung anong nakabara noon? Yung fat ng milk mo na na-frozen or naninigas. yun yung bumara. When this duct is black, naninigas at naninigas yun, hanggat napupuno, lumalaki, hanggat nagiging discomfort, nagiging masakit dahil nga punong-puno na itong kanal na to, itong duct na to. So, could you imagine, this is just a bigger duct. Imagine niyo yung duct natin sa breast ninyo is very, very thin, very, very thin siya. So, nai-stretch yun. Kaya minsan sumasakit. So, my advice to you is, always check your breast kung ano yung side na may naninigas, try to massage it. Hint, ito ang hint na clues na ibibigay ko sa inyo. Pag ang bukol nyo sa breast nagmo-move, okay? Let's say, napifeel mo itong bukol mo this is in your right upper quadrant, right lower quadrant, right upper quadrant. So, pag dito sa upper quadrant naninigas at minamasahe mo siya, nililagay mo ng warm cloth, feeling mo lumiliit, and then may natira pa, do it again, okay? And then if it moves, that's good, okay? That's good if it's moved. Pero pag ang bukol mo, kahit nilagay mo ng warm towel, hindi na melt, hindi siya lumiliit, and it doesn't move, that's a concern. You need to get a check, okay? You need to get a check. Based yan sa knowledge namin when you do assessment sa mga breast, okay? So, in our clinic, sa mga pasyente ko, I always make sure that I demonstrate ko talaga sa mga nanay when you're checking your breast. So if this is your breast, make sure na pag nag-check ka ng breast mo, you check your breast. Either you can do counterclockwise, okay, or you can do by section, by section. Ang gagawin mong pag-check ng breast mo by section, maybe right side first and then left side. So it's always good to do a full check. At hindi lang sa breast, okay, part ng breast. You also have to check dito sa may axilla natin, okay? Dito sa part na to. Minsan kasi nagkakaroon tayo ng nodules, inflammation diyan sa area na yan. Dahil again, hindi sinasabi ko sa inyo, our milk line is like this, right? So, kasali dito minsan, pag nasubrahan ka ng gatas minsan at hindi na-release yung pressure ng milk mo, minsan naninigas din yung under your axilla. So, it's always good to check that part too. Kung may masakit dyan, put a warm towel and massage it. Now, kung talagang it's been months na yung bukol mo never changed its size, it's not moving, you're feeling discomfort, may iba na talagang wala kang nararamdaman. Okay? May iba na wala kang nararamdaman. So, just make sure, get a check. It's always good to get an ultrasound. Ask your doctor to maybe provide ultrasound or do a mammogram kung meron mang available. Dahil alam ko minsan, I don't know kung ang mammogram dyan sa Pilipinas is libre. Get a check. Kayong mga those of you who are not even breastfeeding, make sure you check your breast monthly, okay? When you're doing your shower, para talagang it's always good to prepare yourself, to take care of your health. Dahil breast cancer now, it's increasing, okay? Marami na ngayong mga cases ng mga breast cancer kahit wala sa dugo nila, sa lahi nila. The reason for that, iba na ang mundo natin ngayon. The way how we eat, the way how we take care of ourselves, minsan kalimitan ko lang tayo sa tulog, immune system is very poor, mandaming problema, malnutrition, and so all these factors, sometimes you're living in an area, environmental factors, na maraming mga chemicals, so all these things can really, really affect our health, not just our breast. So it's always good to get a check. Not just you can do. I always do sometimes once a year or twice a year. Do physical check, blood work, para ma-rule out kung ano may diferensya tayo sa katawan natin, your partner as well, hindi yan sa breast, sa mga partner natin, kailangan nilang i-check yung sa mga kidney problem or a prostate problem, dahil kalimitan sa mga lalaki, especially if you drink alcohol or you're a smoker, there's high risk for men who gets prostate cancer. Okay? So get that checked, make sure, alam kong hindi yan komportable yung check, but it's always good now kasi my blood work now on how to check your partner's prostate by way of blood work called PSA. Sa atin, sa mga babae, kailangan talaga nating breast self-examination, kailangan natin ng mammogram kung available sa area ninyo, kailangan natin kung may concern, you need to get an x-ray or ultrasound, okay? Thank you doon sa nag-message sa akin regarding dito sa bukol sa breast. Just monitor it, maybe pag nilagyan mo ng warm or massaging it, lumiliit. If not, continue to follow up with your doctor. It's always good to make sure you're in the safe side, okay? Kailangang alam natin kung may risk tayo ng breast cancer. I had a good close friend before who died with breast cancer na she really refused to get it removed. At because nakikita siguro niya na wala ng pag-asa, kaya it was so unfortunate na hindi yun na agapan kahit maaga pa. So it's always good to check your breast, or you know what, wala na itong kalaswaan. If you're married, if you have a partner, it's always good, like when you're laying down in bed, that when you put your hands like this and let your partner check your breast counterclockwise, okay? Counterclockwise or clockwise. Pabalik-balik yan. Just to make sure na feel yung mga areas kung may mga bukol, okay? And it's good because sometimes kung ikaw yung nag-check, minsan napifeel mo, minsan hindi. So it's better, why don't you ask your partner to do it for you if you're comfortable. So put your hands in there, lay flat in bed, and the partner can just do clockwise or counterclockwise. Make sure that even up to the axilla, mamamassage yun, mapifeel kung meron man. Okay? So again, thank you for the question. Thank you for the comment. Continue to subscribe. Please share this video dahil marami tayo ngayong mga breastfeeding moms who are kind of worried na napifeel nila na may napifeel na bukol sa breast nila. Again, salamat for continuing subscribing me and following me. Marami pa akong pag-uusapan. Marami pa tayong pag-uusapan. Thanks for watching again. Bye for now.